comparison. And my goal for you in this presentation is that by the end, you feel comfortable trying to do a drug plan comparison for yourself or an Advantage plan comparison for yourself. As I think you are all aware, now we're nearing the end of this fall's open enrollment period, which goes until December 7. So you have a little bit of time left to do a plan comparison for yourself or someone else if it hasn't been done yet. And I'm glad John mentioned the YouTube video, because if you do, as you go through, if you want to go back and access some of the commentary here, you can do that by going to their YouTube site, or just go to YouTube directly and then put in SCS Delco, and all of those YouTubes that John has put up will be right there for you. You should know that there's also always help if you just have a quick question. There's always help available from the APPRISE program of Delaware County, where Glenda Radical is our fabulous manager. And so you might want to note this phone number, 484-494-3769. She's always glad to answer a quick question if you have one. One thing I would say is that it is really important to try to do a plan comparison every single open enrollment period, because these plans change, and it can make a huge difference from one year to the next. I just worked with somebody who had a plan that she liked that was great for 2020. And then I found out this person happens to have an enormous number of medications. So if she continued with that plan, it was going to cost her roughly $20,000 more than if she went to a different plan. So that was pretty eye-opening to me. I've never seen it quite that bad, but it really can make a difference. So if we can move to the next slide, John, we'll start working our way through the process. You do a plan comparison on the Medicare.Gov website. So you want to go there and click on Find 2021 Plans. See that box that the red arrow is pointing to at the left side. Then when you click on that, that will bring up the next slide, if we can move on, and that gives you a place to log in or create an account. See that red arrow. If you've already created an account for yourself or for the other person on Medicare.gov, then you would just go ahead and log in. But many people have not, because this is a relatively new process. And so then your next step is going to be to create an account. So you click on that button that the red arrow is pointing to. And then if we can go to the next slide, you will see it's a little less obvious where to click on create an account now. So if you have it, you log in the boxes provided there. Otherwise, you click where that red arrow is pointing. I want to explain briefly why it is that you might want to create an account now, because I think some people don't like the sense of that. The real benefit of creating an account now, one of them is if you are looking for an Advantage plan, later on in the process, you will actually want to log out of Medicare.gov and then call doctors to make sure they accept the Advantage plan you are looking for. And then you would want to log back in. It will be oh so much easier to log back in if you have already created an account, and then you won't have to put your drugs in all over again. The same thing is true when you come to next fall and you want to just check again to see, okay, what is the best plan for me? if you have an account, you log in and your drug list will be right there. And that's the most important part of choosing any plan. So it will just be much easier going forward every year. And also, it can be handy to have a Medicare.Gov account, because I don't know about you, but every now and then I have questions about what something is, what this charge is, where it comes from, what I actually have to pay. You can log into Medicare.gov and see anything you need to know about what's covered under Medicare, what your claims are, etc. So I recommend creating an account. So now let's assume you've clicked on that little blue link the red arrow is pointing to, and it takes you to the next screen where you will begin creating your account. You will need your red, white, and blue Medicare card, your Medicare card, to fill in some of these boxes. Most of this is pretty self-explanatory. You put your Medicare number there in the first box, and then, the email address, you can just skip and tell them you don't have one if you want to, whether that's true or not, but then you won't get email from them. The one thing that can be a little tricky is over there where the red arrow is pointing. It asks for your Part A start date. That is also found on your red, white, and blue Medicare card. So once you have filled in all the information there on that screen, you'll see a pattern forming up here. There's almost always a green next box at the bottom of the slide. Thank you, John. And so pretty much when you finish with any page on the Medicare site, you click next, and then it takes you to the next screen. So if John, you would pretend we'd done that. There we go. Now, in setting up a Medicare.gov account, the first thing you need is a username. It's perfectly fine to just use your email address or some other familiar username. It doesn't really matter. You decide what you want. The trickier part is creating a password. It has to be 8 to 16 characters long. It has to have one uppercase, one lowercase letter, at least one number. And then they show you those particular special characters, and it has to have one of those. You can't use anything else, and you have to use one of those. Once you have decided what you're going to use for your username and password, write them down on a piece of paper or whatever you do to keep important information like this, and put it somewhere where you can find it for your records when you need it. Because you will need it again every fall, but also if you go, when we can get back in person, and you speak with an APPRISE counselor about something involving Medicare, it will be very helpful if you will bring that piece of paper with your username and password so you and the counselor can log in together. The one other thing you have to do in setting up the account is they ask for you to have an answer to a secret question. I would say choose the easiest question for you to answer, preferably one with only one word, and then put that down on your little piece of paper also, so you'll know exactly what you said was the answer, unless it's so obvious that there's no debate. Okay, now, once you've got that username and password, the program will automatically take you back to the login field, and you will use your new username and your password to log in. So simple enough. So now if you were somebody who already has that, this is what you would be doing. Now we're all back on the same page. So you're going to click you're going to put your username and password in, and then click log in on the green login button. When the next screen pops up, you're going to click on find plans, because that's what you want to do. make sure that what you are looking for are 2021 plans. The type for that is kind of tiny, but because you could be representing somebody who is just turning 65 on December 2nd and wants a plan starting December 1st. Then you would look for 2020 plans, but you really want to look for next year's 2021 plans. So make sure that's what you have there. Okay, then that will all take us to a new screen. Whoops, what happened there? I lost my screen. There we go. That gets you started on your quest for a plan comparison. So depending on what kind of plan you're looking for, you check the appropriate box. Notice again here, it says, we'll show you 2021 plans. That's what you want to be sure to have. You check that first box, the blue arrow is pointing to if you're doing an Advantage plan comparison. Otherwise, you check the one the red arrow is pointing to that says Drug Plan Part D. Then you enter your zip code and hit continue. Funny thing. Next up, in Delaware County, 19087 involves multiple counties. And believe it or not, these plans are county specific. So it really does matter what county you're in. So that's why they ask you that. You check that box. And then you answer the next question about whether you get any form of extra help with your drug costs. And fortunately, there's an I'm not sure box. So you just check the right one. And again, there's going to be a green next box at the very bottom of the page that doesn't show up in this slide, but that's how you would move on after that. Now you're starting to set your preferences for how you want to go about this. They ask first, do you want to see your drug costs when you compare plans? Well, that is pretty obvious, yes, because that is the biggest thing that you need to see in order to determine what's the cheapest plan. If you don't put that in, you don't really get much useful information. So you want to check yes for sure. And then how do you normally fill your prescriptions? I recommend checking both unless it's somebody who really doesn't want to deal with a mail order pharmacy. But often a mail order pharmacy is both cheaper and easier once you get going with it. But that depends a lot on personal preferences. So check whatever circles are appropriate for filling the prescriptions. And then that will take us to what is really the hardest part of this whole thing, creating or editing your drug list. If you have been a Medicare beneficiary for a while and you create an account, Medicare should have a list of the drugs that you have purchased in the last while, and that should pop up. And then you would edit that list. Otherwise, you have to put in each drug one at a time, as we're going to demonstrate here. So if you're new to Medicare, so they don't have any drug history for you in their computer system, you have to enter each drug one at a time. So if we were starting here in that first box where it says begin typing to find and select your drug, you would type in the name of your drug, and then usually a list pops up below that has things they think you might be looking for. And you click on the one that is the one you want. Then the add drug button that here is gray will turn to green, I think it is. And you click on that, and then that asks you for other information about what the dosage is. So like how many milligram tablet is it or whatever. Then also how many do you take in a month, or how many do you take in whatever the time period is that you're buying for. A lot of drugs you can now buy for in a 90-day supply. So then you have to figure out, oh, okay, so if I take one a day, that's 30 a month, that's 90 for 3 months. Or I take 2 a day, that is 180 for 3 months. So you have to fill in all that information for each drug. When you finish with one drug, there'll be a green button that you hit that says done adding drug or add drug, and then it will bring you back to this screen and you will just keep going, adding the drugs and making sure the information is there until you have entered every prescription drug that you take regularly. You do not want to include any over-the-counter medicines in this list because those are not covered by a drug plan. And you also don't want to include something that you don't take regularly, but you know, like sometimes people have a cream that they use every so often, but you know, they don't buy it all that often. So then you don't want that to really determine which plan is best for you. Okay, once you've got your drug list complete, you will get a screen like this next one. Thank you, John. And it is really, really important to proofread this list very carefully. So you see over there in the first example, they have the name of the drug, Mydayis, and then the dosage, 25 milligram capsule extended release. Then how many, so the how many has to go with the frequency. So do you take 30 a month, et cetera, the way I was saying before. If there's some error, you can see the gray arrow there is pointing to a little link that says edit drug. That will let you go back and just fix that one drug. So for each drug, work your way down and make really sure that the information is correct. Let's go to the next slide, John. Particularly if you are already a Medicare beneficiary, and so you were lucky that you got a list that popped up automatically and you didn't have to do all that typing. At the same time, there's a risk in that because there are often errors in that list. So you really, really need to proofread extra carefully if the computer generated most of your drug list. Check the names. They aren't always right. Especially check the dosage and the amount. And especially for anything that's not a pill. I've seen a lot of errors with creams or ointments or injections. Like it'll think it's once a day and that you use the cream. So then they'll put in that you need 30 tubes a month. Well, you don't need 30 tubes a month. You need 1 tube a month. So that's a place that there often are things. Sometimes there are duplicates that you need to delete. Or the other thing that pops up you want to delete are things that are infrequent. I know one time I did a plan comparison for my husband, and it had this item on it that I forget, it was over $100, and he doesn't take anything fancy, and I couldn't figure it out. Well, it turned out it was the shingles shot that he had had. So obviously the shingles shot, he's not going to keep doing every year. You do it and you're done with it. So there are other things like that that will pop up. You want to delete. You only want the things you take regularly. Once you have really proofread your list and you're sure it is right, then you find the little handy green box at the bottom where the red arrow is pointing, done adding drugs, and that will bring up another screen. You move on, and now you've really done the hardest part, I'm happy to say, for at least for a drug plan. Okay, now they want you to choose pharmacies. I recommend choosing the mail order pharmacy, which is always the first one, and then 3 or even 4 others, because you want to get drug plans to choose among, but you want each drug plan to have a choice that is an okay pharmacy for you, that they treat as a preferred pharmacy. And this might be the most important concept you come away with today. Each drug plan has one or more pharmacies that they consider preferred. They have another category that's in network, but that's a little broader. To really get the best prices, you have to use the preferred pharmacy, or sometimes the mail order pharmacy. So you want to have a bunch of pharmacies to choose from. One thing I noticed recently in doing some plan comparisons, if you look on this screen, I hope you can read it, it's kind of tiny. Right above where that red arrow is, there's a gray box and it says filter by distance 5 miles. I've noticed that they now have the default is distance 1 mile. And so then they hardly show you any pharmacies. To change it, you have to both choose distance 5 miles and then also hit apply or something. So there are more pharmacies to see if you make the distance bigger. Anyway, you go down, you check. I generally try to check CVS, Rite Aid, Walgreens, Save On, Costco sometimes, if that's good. What else is on my little list? Oh, Walmart. Those typically are the preferred pharmacies. So if any of those is accessible to you or the person you're doing this for, I would put those choices in so you can get the best price that you can for your whole thing. All right, so now you've got your pharmacies, and as you click them, you'll see them appear in that blue bar across the bottom. It's kind of tiny to read, but that lists the pharmacies. And when you've finished that, choosing your pharmacies, you click that done box, the white one in the bottom right, where the yellow arrow is pointing. Okay, once you've done that, the next screen that comes up shows you a whole list of plans. See over there on the left, it showing 10 of 33 drug plans. Well, you could keep going and see more, but that's good enough. These will either be drug plans, if that's what you're looking for, or advantage plans that are available to you in the county where you are. So whichever type of plan it is, you want to look over there where that red arrow is and make sure that it says lowest drug plus premium cost. That is now set as the default, so it should say that, but make sure it does, because you might have a premium of $15 for one plan, but in the course of the year, the drugs are all cheaper. So you come out ahead compared to some other plan that has 0 premium, but higher priced drugs. And what you care about, presumably, is the total for the year. So that's why you want that lowest drug plus premium cost. If you don't see that little box for lowest drug and premium cost, it's because you are somebody who's already in some plan, and then the program automatically lists that plan first, and then they put the sort plans by and all the new plans under that box. So they have yours, and then you would have to scroll down a little to find that box that says lowest drug plus premium cost. But it's there either above or below that first plan. So just make sure it says the right thing. Okay, from this point on, we can move to the next slide, John. The process differs slightly depending on whether you are doing a drug plan comparison or a Medicare Advantage Plan comparison. So if we move to the next slide, Since the drug plan is the simpler one, I'm going to review that first in the next 6 slides. And then I'll go back and I'll do the parallel process for finding the best Advantage plan. So if you're only interested in comparing Advantage plans, just hold tight for the next 6 slides, and then we'll be back to that process. So thank you for your indulgence. For those comparing drug plans, let's go to the next slide and see how this process works. So this is basically the same picture we were looking at before, where we looked in the top right corner and saw that they were sorted by lowest drug and premium cost. The top one will be yours if you already have one, but then you can scroll through the next several and see. Now, what do you want to look for? Often people care about the star rating, although sometimes plans are too new to be measured, like this one here. I would say that's important, but that's not the most important thing in choosing a drug plan typically. Then they're going to show you the monthly premium, which is relevant, but as I said, what you really care about is the yearly drug plus premium cost. So in this plan that we're looking at, the total for all the premiums and all the drugs for a year came to $247.20 at a retail pharmacy. Now that assumes you are going to their preferred retail pharmacy. You won't get that price at every retail pharmacy. And then in this one, the mail order price is the same. That's actually somewhat atypical. I would say this person is not taking very many drugs because that's not all that much to spend for a whole year's supply of medication. That person's going to be in the deductible all year. Okay, so you want to look at the plan, pay attention to that yearly drug plus premium cost. I would say in all events that whatever the first plan is that comes up, if it's your plan that you're already in, you want to click that little white add to compare box that is down there to the right of where it says plan details. There's that blue box, and then to the right it says add to compare. If you click on that little box, not in the bottom right, but yeah, up where John is pointing now, if you click there, then it will show up just the way it did with pharmacies across the bottom. So click your current plan if that's showing up, then click the next one. Then you want to scroll down through the next several, paying really close attention to the yearly drug plus premium costs, because these are in order by retail pharmacy. So you may find, if you're somebody who is interested in mail order, that there is a cheaper plan farther down where the mail order is cheaper, even though the retail is more than whatever the first plan was. So scroll through the next, I'd say 3 or 4 plan choices, see if there are 1 or 2 that look like they're either equivalent or cheaper in some way. Click that add to compare box until you have a few plans listed across the bottom in that blue bar. And once you've done that, you click the white compare box that the blue arrow is pointing to there in the bottom right corner. That will bring up something that will show you all 3 plans side by side. So in this case, we have a WellCare Value Script, a Clear Spring Health Premier, and a WellCare Wellness Plan. Now, the first information that they show you is actually not all that helpful, because remember, again, what we really care about here is the total for the year, not the premium. But that's all very interesting. What you really need to do here is to scroll down farther through the plan comparison until you get to the information that says drug coverage and costs. So you just have to go down farther in this, and the next screen, John, will show us what we are ultimately coming to. See over there on the left, it says drug coverage and costs. That's what it will look like. And then it will show you for each of the 3 plans what the estimated total cost is for the year for that plan at different pharmacies. So here's where you want to look for the preferred in-network pharmacy. That Humana plan doesn't have one because they only use mail order for preferred. But the other 2, one of them has Save On, that's the pharmacy at the Acme. And the other one seems to use CVS as their preferred pharmacy. So you just want to make sure that there is a preferred pharmacy in each list. If you don't see a preferred retail pharmacy, scroll back up to the top and there will be a link that says go back to the plan results. And then you can scroll up and go back and edit your pharmacies and try to make some different choices. But if you've chosen a fairly wide selection to begin with, then you should be seeing at least one preferred in-network pharmacy in the list. If there isn't one, you really do want to keep trying because that makes the biggest difference of all in my experience in these plans. Okay, so let's see, let's move on to the next slide here. Oh, here's where you're going back, I'm sorry, and fixing it. So you scroll back up and click on edit your drugs and pharmacies if you need to. But let's assume you've got 2 or 3 plans to compare, and you have a preferred pharmacy for each one, and you want to remember what that pharmacy is. Then let's move on to the next slide, John. Okay, so you want to go back to that part that has estimated total drug and premium cost and decide which one works best for you. Now, what is because that's really the most important factor in making your decision. So your screen will look like this, and you really do have to get out your magnifying glass and sort of hunt around and be sure what's the cheapest option. And then there are some fine points. So if you were looking at this, how would you decide among these? Can you spot which one is the cheapest option? I think it is the WellCare Wellness Plan in the left column that uses all mail order at $64.82. Or for a tiny bit more, if you went to the Save On pharmacy at the Acme, that's a preferred in-network pharmacy for that one. Then you would be at $65.62. Notice how the Walmart pharmacy for that first plan is also preferred, but it's not as cheap as the Save On. And then look how the price goes up if you went to CVS or Rite Aid. And this is for somebody with hardly any drugs, because that's really cheap for a year. So you can see that the pharmacy that you use makes a huge difference. Now, let's see, what was I going to say? I guess the other thing to look at here is these are sort of fine points. So basically, I would have been inclined to choose that plan on the left because that was quote unquote the cheapest, and I would use a combination of mail order and the Acme. But you might not live that close to an Acme or in this case a Walmart. But what if Rite Aid is the one you really like? then if you look over on the right, you can see that in that plan, the Rite Aid is $89. So that's a little more than going to the Acme, but you might decide that over the course of a year, you know, that $24 difference was, or no, $34 difference was worth it to you. So that's just something to think about. Or the other thing is, it's a hassle in a way to change pharmacies because you have to get all new prescriptions. So that's another place. It might make it worth the higher cost of, say, the Rite Aid in the Clear Spring plan on the right. So you want to think a little bit about the accessibility of the pharmacy and the cost spread, and also the hassle of changing your prescriptions. You can change plans and not need new prescriptions so long as it's the same pharmacy. But if you change pharmacies, that's when you need new prescriptions. And then this is also, if two plans seem basically the same, that's where you probably want to look at the star rating. Before I leave that comment about pharmacies, some people just really want to go with their local neighborhood pharmacy that they've had a relationship with, the delivery is good, et cetera, et cetera. And just know that if you do that, you're probably paying more. And in this summary, you can see how it works out. It doesn't mean that you always have to buy every drug at the preferred pharmacy for that plan. There might be some drug that's really cheap that you buy somewhere else. But I think you see the drift here of what is most, or how to find the one that is the least expensive. So let's move to the next slide. Pretend we think that that WellCare plan on the left is the best because it's the cheapest, and that's what you really care about. All you have to do to finish this process is to enroll. You click on that green enroll button under the WellCare Wellness Plan, and then a few more windows will pop up where you can complete the application online. It's quick, it's easy. Once you've done that, they will notify your 2020 plan, your current plan, that you are not continuing in 2021. And it will also automatically send the information to the new plan that you've chosen. And then you will start getting mail from them with a new card. So now, drug plan people, hang on, because there's some important things at the end of this whole presentation, but we now need to go through the steps of how to make the comparison for the Advantage plan. So we're going to go switch back to comparing Advantage plans. Again, with Advantage plans, your primary concern is cost, but you will see that it is a little more complicated to determine what the cost of an Advantage plan for a year will be. Let's go to the next slide, and this will pick up where we left off before. I guess that John is making a good point. Does anybody have questions about drug plans that it would be good if we asked or answered right now?
So I have a couple in the chat that I wanted to bring up real quickly. Couple of questions. One, Pat Bear says that she noticed a Medicare storefront in Manoa Shopping Center on Westchester Pike in Havertown. Is that legit, and how would that help her?
I have no idea. I don't know what they would be.
Yeah.
I did know, Pat. I don't know what that is.
Okay. Sorry we can't help you on that one.
Sorry, I can't help you.
Let me open it up for a second for Janet. Janet, did you have a question?
No, I didn't.
Okay, I saw that your hand was raised. Just wanted to make sure.
Yeah.
All right. Last two questions. Again from Pat. What if I use mail order for long-term but need a 10-day prescription from Save On? And also she noticed a deductible on the previous pages. Where does that come into play?
So you can easily switch back and forth from mail order to whatever other pharmacy you're using. That doesn't really matter. And I agree with you. I typically use mail for long-term, but then other things I might go to Save On. Although I have been surprised recently that sometimes the retail pharmacy is actually cheaper than mail order. I used to assume mail order was cheaper, but it's not always anymore. So you want to pay attention to that. The deductible comes in at the beginning of the year. And that doesn't, if you hop around from one place to another, that doesn't matter. Medicare is sort of keeping track of how much of the deductible you've paid. I have to think what the deductible usually is here, but I'm trying to see if it says on my some little cheat sheet. No, there often is a deductible, and you end up paying that in the beginning of the year. So your drugs can cost more in January and February than they cost later on. Although if you get into what's referred to as the donut hole, then they go back up again. So I don't know. Does that answer your question, Pat? Ask again if it doesn't.
I think what I was thinking of, I think I saw like $400 deductible in some of these drug plans. And I thought, if I'm paying a premium, do I have to meet the $400 deductible for the year first before I can start getting the reduced prices at my mail order and preferred provider?
Yeah, somehow you still do get reduced prices even when the deductible, even before you've met the deductible, because I
Okay.
know that when I buy either at the pharmacy or online, I'm not paying anywhere near the full price, but I don't take a lot of drugs and I never meet my deductible in the whole year. So I know I'm still somehow getting a discount. I'm not quite clear how that works, but I think it comes into play more if you have a lot of medications and then you pay more in the initial period until you have satisfied your deductible.
Okay, I think I got it. Okay, thank you.
If you do the comparison online, it can actually show you what your monthly costs will be when you get down into the details. Now, they're assuming that you are starting with no prescriptions. And so you're buying everything in January. And then if you're buying a 90-day supply, then you're renewing that in April. So that's one reason the monthly amounts go up and down, but that can give you a good picture of how the costs will be spread throughout the year. And they show you that, believe it or not, for each pharmacy that you have selected in your comparison. So there's a lot to look through in the details of the drug plans as you scroll down, especially if you click on the details for each plan individually. That's where you get exactly what each drug costs at a particular pharmacy in the different stages of coverage and then across the months. Anybody else got drug plan questions?
That is it, I think.
Okey doke. Then let's take a deep breath and go back to the Advantage plans, where if you had been looking at Advantage plans originally, this is kind of where we left off, where you brought up the list of however many Advantage plans were available. And we had said that you go over and look for that sort plans by box that says lowest drug and premium cost. If you're already in an Advantage plan, that box will be underneath your first plan. But Advantage plans have a lot of different components to them. And so they let you filter by certain things that you might care about. So in doing an Advantage plan comparison, you want to click on that green filter plans box that will be at the top right of your screen. There's a red arrow pointing to it over on the right of this screen. And when you click on that filter plans box, it will bring up a new screen that will give you different options. So you're probably aware from either advertisements you've gotten in the mail or seen on TV that Advantage plans, part of how they compete with each other really is the kind of side benefits that they offer. So you might care about getting fitness benefits. That's probably the most popular. You might be interested in transportation or vision coverage or all of the above, whatever. You do need to know that sometimes it can be harder to find, say, a dentist that is in the plan than you might think, or a vision coverage that's in the plan. But, you know, if that's a benefit that you're really looking for, check that. You can check all 5 of those if you want to. The second thing is they give you an option to, if you only want a certain kind of plan. Most plans are labeled HMO, meaning you use plans in their network. PPO is a little broader. We'll talk about that in the next slide. Then over on the right, you could ask for a certain star rating, but I would encourage you not to do that because sometimes plans are new, and then if you want them to have a star rating, they're too new to have a star rating. They might be a perfectly good plan, but it's not going to show up for you if you require a 4-star rating. And same, I wouldn't bother with an insurance carrier because what I would assume you were wanting would be the cheapest plan that provides what you want. You definitely do want to have it include drug coverage, the bottom right, because you want an all-in-one plan if you're doing an Advantage plan. So pretty much the things that you're going to click on here are those benefits over on the left. Once you have done that, you go down to the bottom left corner there where it says apply filters, and you click on that. And then it brings you up plans that meet those. Now let's talk for a minute about these PPO plans. Some of the Advantage plans are labeled PPO. That gives you a greater opportunity to go out of the network. But when you do, you will pay a little more, but it won't be nearly as much more as if you had an HMO plan where you were basically required to be in network and you paid the full cost if you go out. So if you want sort of a little looser, a little more flexibility, you probably pay more for a PPO plan because part of what you're getting is flexibility to go out of network. And the way that these plans function really depends on their network. That's how they keep the costs down. So that's just a little primer on PPO versus HMO. Let's go to the next slide. Once you have applied all your filters, then the list is going to come up with plans in order of total drug and premium cost for the year. You want to scroll down through maybe the first 5 or 6, I would say, and you're going to take note first of that star rating, or is it a brand new one? That's not a super important item, but that's where that top left arrow is pointing. Just sort of file that away in your brain. Then you want to look at the monthly premium, which, as they note here, does not include the standard Part B premium. You still pay that. So there are lots of Advantage plans that say no monthly premium. And some people think, oh my goodness, great, I don't have to pay anything. You still have to pay Part B. Okay, then it shows you, this is somebody who has hardly any drugs, your yearly drug plus premium cost in this plan. That's a very relevant amount to be looking at. Then in the bottom left corner, you want to see whether there are any deductibles for in and out of, especially for drugs, but you also want to see what the maximum is for a year. So this is sort of like a cap on what you might have to pay, because typically Advantage plans are cheaper if you stay healthy, but are more expensive if you happen to get sick. So it's good to know what the maximum you would have to pay in a year is. So in this plan, it's $7,550 if you stayed in network or if you went out of network. That's partly because this is a PPO. Over there on the right, it lists the benefits that you checked that you wanted, and it would also show other ones that are there. The piece that you really want to pay attention to is down there in the bottom right. What am I going to have to pay as a copay every time I go to the doctor or every time I go to a specialist? So you can compare up to 3 plans. So look through the first several and see which ones seem to meet your needs. Again, there is a little box at the bottom of each one where you can click Add to Compare. So let's go to the next slide. I think it shows up on that. Yeah. And just the way with the drug plan, once you have selected 3 plans to compare, they're going to show up across the bottom, and then you want to click that white compare button that will bring up the 3 plans side by side and let you really assess the details better. So let's pretend you chose these 3 plans and you clicked on compare. Then you would get a list of, or this spreadsheet of your 3 plans, the Aetna Medicare Advantage Value Plan here, the Cigna Health Spring Alliance plan here, and the Humana Gold Plus plan. Note, these are all HMO plans. So this only really shows you the most basic information here, but the one important thing in this first slide that you can see, notice right above those blue boxes, it says the maximum you pay for health services. So 2 of them have a $6,700 in-network maximum. The one on the right has a $5,900 in-network maximum. So that might influence your choice. An Advantage plan is really, the choice is you have to weigh different pros and cons. So that's why that might be a definite pro for Humana that you can see at the beginning. But what you really need to do is to scroll down further in this comparison. And the next slide will show us some of that. So in Medicare Advantage plans, it really is necessary to look at the details and to think how they apply to you. So, for example, first one, doctor services. Now these don't have any copay for any of the three choices for your primary doctor visit. But pretend you had some condition and you needed to visit a specialist once every 3 months. That plan on the left is going to cost you $45 a time, where the one in the middle is going to cost you $30 a time. So you need to pay attention to that. Then maybe you're somebody who needs lab services or diagnostic tests on a regular basis. You can see that like the diagnostic tests, the one on the left always has a $20 copay. The other two have $0 to $105 for the one on the right. So you might want to find out more about your particular test. What is the copay for it? Or look at lab services, $5 versus $0 versus somewhere between $0 and $35. So you can see just from this slide, there's nothing all that standard about Advantage plans. You really do have to think, which of these services am I most likely to use and how often, and what does that mean I might end up paying? And maybe you need some kind of surgery. Notice the hospital services. The plan on the left says $450 per stay. The one in the middle is $275 per day for days 1 through 6. So if you were in there for 6 days, you'd be way better with the left plan. The one on the right, it's only $275 a day for days 1 through 7. I think you're already getting the drift. There is just a ton of detail, and you really have to try and think what is most likely for you, given what you think is most likely to happen. It's just really hard to know. Keep on scrolling down until you get to the drug costs. When you get down there, be sure to check that there is a preferred pharmacy shown under each plan. We talked about this a lot above for the drug plans. The same is true here. You want to know what is the preferred pharmacy for the plan you're thinking about choosing. Make sure it's one that's okay with you, and make sure that that there is something preferred, because if it's only standard in network pharmacies, that is going to be more expensive. If you don't see a preferred pharmacy listed, so say that CVS pharmacy wasn't in your choice list and all you saw was standard out of network, then you would want to click that change pharmacies button in the top right next to the green feedback there, and go back and add some more pharmacies to see if you could get one that's preferred for this plan that otherwise seems to be cheaper. And then make sure you use that plan. Okay, moving on. Once you've scrolled through all of these details, and hopefully you've either made a little chart of pluses and minuses for the things that you cared about, try to rank your 3 plans in order and make a list showing the exact name of each plan, because there might be Aetna, Medicare, Advantra, something else. So you want the whole name of each one. And rank them in the order of your preference. Now it's time for the most important step, which is finding out whether your physicians and hospitals accept the plan that is looking good to you. Okay, so move on to the next slide. You can actually log out of Medicare at this point. You are going to call your physicians and hospitals, and you are going to say, I am considering this plan, and this plan, and I want to know, do you accept all of these? So find out, and then, you know, maybe you have 2 or 3 physicians you go to, or maybe you really cared about the vision and you want to call your ophthalmologist and see if that person is in this plan. So you want to check with everybody you might use to make sure that they accept the plan you're thinking about. And that will usually narrow down your choice a little bit more. Once you have made those all important phone calls and you know the ones that your doctors and hospitals accept, you are going to probably take a big long break, and then at some later time, sit down again at your computer. This is where your login becomes important. You log in again. Then you go through all those steps we just went through, but it'll be really fast because you've already proofread your drug list. So that, which took a long time before, will be quick. And then you kind of know what pharmacies worked out. So you quickly choose those. And then you got back to the list of available Medicare Advantage plans. So now go through again, you're going to, and click add to compare for the ones that your providers accept. No point comparing one that the people you want to go to don't use. So let's say they accept Aetna Medicare Advantage Value. You would click add to compare for that. And let's say they clicked there was one other one that they had, you click that. Then you are going to be ready to make your final choice. So you've clicked add to compare for a couple, and then in that blue bottom line, you're going to click that compare button. Then it's going to bring your comparison back up again in the next slide. So you probably want to scroll back through all those details again. You have one last chance to review all of them, think back over, and then decide based on the different factors of how much it costs for the premium plus drugs for the year. How much is this maximum that you could have to pay in a year? What's the star rating? And how much are you likely to have to pay in different copays, depending on what you're likely to use? And also, I would say the hospital costs. If you ended up in the hospital, how much more expensive would it be under one plan than another? And then you weigh all those differences and decide on the one you want. And once you've made the decision, the rest is really easy. You click on the enroll button under the plan that you want there. Or you can always enroll in person. Some people prefer to do that. And each of these plans has a local agent that you can talk to. If you just call the APPRISE office for Delaware County, Glenda can give you the phone number for the local rep of the plan that you have chosen. So you can either do it online or by calling up. Okay, I think now I have some important points that apply to everyone, and then we'll take the questions, if that's all right. So moving to the next slide, just a few reminders. If you switch to a new plan, you might need new prescriptions, but it's really mostly if you switch to a new pharmacy that you need new prescriptions.
10 minutes.
Okay, and then when you switch plans, be sure you put the new cards in your wallet by January 1 so that you have them and you bring them out whenever you go somewhere. And I hope I have impressed on you that once the new plan becomes effective, make sure you use the preferred pharmacy in order to get the best price, unless it is that mail order is cheaper. But using standard pharmacies will definitely cost you more, although as we said, you might do that on purpose because there was some other benefit. And lastly, on our last slide, mark your calendar for next fall. Remind yourself to do this plan comparison every fall. It can really save you money in the long run. And if you need assistance, or as I said, if you wanted to get the phone number for a local rep of some Advantage plan, there's the phone number for the APPRISE office. And Glenda will answer that phone number. And also, if you were doing a plan comparison, you just had a quick question, or you were doing a plan comparison and you thought, oh my, this is too complicated for me, I really want to talk to somebody, Glenda can help you with all those things. So that would be the contact number. Okay. I guess I should go into the chat here and I could see questions.
Yep. So Pat Bear, make sure I'm not muted.
First one is there were 52 plans in the list. No, Pat, you don't want to look at all of them. I would only scroll through maybe the first 5 or 6, and then I would choose the best 3 out of those to compare. So that would be, you definitely don't want to look at all 52, you go crazy. And you can definitely filter by PPO only if you want that. Yes.
Thank you. Okay.
Yep. Other questions from anybody?
All right, ask you all to unmute. So if anybody has any questions.
Yes, speak right up. Well, yeah, were you about to ask a question? Guess not. All right. Well, then I would thank you all a lot for participating. There are only a few days left, exactly a week in this year's open enrollment period. So I encourage you to try and do this soon so that if you have questions and you need some help, you can call Glenda and get a little quick help with whatever it is. But I really hope this is making you feel like you could do this every year, and it would be pretty straightforward. I would say, just in my experience, the best drug plan for any particular individual tends to change at least 2 years out of every 3. The Advantage plans, not as much, because you're limited to the ones that your doctors accept. So there are not that many to choose amongst, and the way of figuring it out is a little more complicated. So they do change. It's important to check. The drugs can make a plan not be as good for you, or particularly, you know that you're going to have a hip replacement in February. Well, then you want to look at what kind of services that one will require, and you might want to change. So it's always important to check both Advantage plans and drug plans during open enrollment. Advantage plans actually also have a second open enrollment period, which is from January to March. It's kind of bizarre. They give everybody from December 7 to January 2, I guess, off. And then you can start over again if you want to and choose a different Advantage plan. But the drug plans can only be done in this fall open enrollment season.
Can I ask you something else?
Absolutely.
All right, 2 things. First of all, why would they put like 35 or 52, whatever number of plans there were, if it's only important to us to really look at, like, say the first 5 or first 10? And the other part is, I have been looking a little bit. Actually, I got scared and overwhelmed, but I noticed there's plans in there I never heard of, like Erickson plans, which I think of the Erickson living communities, and I see my doctors accept them. but I've never heard of them before. So is there anything that I need to be wary of?
I think they have 55 plans because those are all the plans that are offered in Delaware County. But that doesn't mean you need to look at all of them. And really, it depends a lot on the drugs that you put in, which one pops up. Or like some people have this, want to look for only the PPO plans. Well, that would cut the list down a whole lot. So, or some people don't care if they have transportation and fitness benefits. So that would change the list. So the computer just automatically sorts them. And that's why I say you really only need to look at the top several, because after that, they're just going to be getting more expensive. It's nice to see everybody's face here popping up.
It dawned on me that I didn't need to keep the question slide up anymore.
Yeah.
Well, thank you very much, everyone. Again, we have one final presentation comparing last year to this, or this year to next year's Medicare plans coming up on Thursday at 11 o'clock. We offer this programming free of charge. Counseling is free of charge. All of that's free of charge, but SCS is a nonprofit agency that provides many, many different services to Delaware County seniors. Tomorrow is Giving Tuesday. If you're looking for a charity to support, visit our website, www.scsdelco.org. There's a donate button that you could hit there if you'd like. So thank you very much for listening today. We'll have this up on YouTube by the end of the day tomorrow. It will be rewound on Facebook and available within a half an hour of the end of the program for now. Thanks again, everyone.
I have a question.
Thank you.
Now.
Okay.
Sorry.
Okay.
When you said Medicare, do you mean the supplemental? Well, do you ever do things to evaluate the supplemental plans?
Oh, that's a great question. The supplemental plans are not included in this plan comparison because basically the only time you choose a supplemental plan is when you are first going on to Medicare. Because that's the only time when the plan has to take you regardless of your health conditions, and they have to give you the same price as everybody else. If you've already been on Medicare for a few years and you have a supplemental plan and you want to change,
Yes.
it's possible, and you can change at any time you want. Supplemental plans are more like car insurance.
So where can I do a comparison for that?
There is a comparison on Medicare.Gov, but you can also make an appointment through Glenda because as an APPRISE counselor, I have access to a Pennsylvania site for the ones that are available to people in Pennsylvania. That's how I've always gone about it for people. I confess I've never.
So I need to contact.
So I would contact her, but you need to realize that the person who's advising you can only see what the stated price is for you.
Well, basically, if I stay with the same plan, they're all the same. Each plan has to be the same.
Right, each plan has to be the same, but
so different companies offer different premiums.
This is true. And if you are still in very good health, you could probably change and maybe get a different plan. And one kind of change you might think about, I don't know what kind of supplement.
Well, I've already done that once. I went from F to G because of cost.
Right, that was a good idea.
Yes, but then I want to compare all the G plans of all the companies, and I don't know where to access that.
Right, I think you could try doing that at Medicare.Gov because there is a button you can click at the beginning that says supplemental plans, but I've never done that, so I can't really offer you.
Oh, okay. Well,
If I
I'll try it. I'll look there and then I can always call
You can
Price.
always call Glenda, but you should realize that if I were doing it for you and it showed me let's say we put in that you were a 70-year-old female who was not using tobacco. Those seem to be the main things they care about. Then I would get a price, but they wouldn't necessarily give you that price because they would still want to look at your health conditions and then they would price it
Right.
accordingly.
Yeah, you usually
But
have
at
to
least
fill
it
out the
gives you
form.
some idea.
Yes.
And the other thing to consider with supplemental plans is that AARP offers supplemental plans. I think they're the only people who do this, where everybody pays the same rate. So and it goes up every year because of inflation, but it doesn't go up because you got older and riskier.
Oh, I thought it did go up when you had a
Well,
birthday.
most of them do go up because you get older and riskier and because of inflation. The thing with the AARP plan is, again, if you get into it early, then you're probably paying more, but in the long run, you probably pay less. Because
because I have heard it's more expensive.
Yeah. So it sort of depends, I guess I'm saying, but
Right.
that plan is priced in a very different way from all the other plans.
Okay.
I have a question.
Mhm.
I had a stroke. So I had Medicare primary and Blue Cross and Blue Shield secondary. And Blue Cross is expensive as anything. And I'm looking for right now, AARP. So what should I do? Just like, what should I do?
I think so for a different supplemental plan,
Yes.
right?
Yes.
So again, you could get one of our counselors to do a supplemental plan comparison for you. But then you would want to call those plans and you would have to see what it was going to cost. They would want to get your medical history and then you would have to see. So it's hard to know.
Well, put it this way. Last week I called several, like Clover and everything, and they wanted my like Medicare and I all kinds of things, and I was like, I don't think so. I don't think so. What do you think?
I think if you did a cost comparison, you could not, well, and maybe you mean when they were, well,
they said, well, give me your name, the address, and ID number and Medicare number and what else? The phone number, my phone number. I was like, I don't think so. I don't think so. What are you saying?
Unfortunately, I think that usually is what you have to do. You have to give them all kinds of information.
Really?
So, I mean, and they will literally, they will check with your doctors and get your doctors to send them all kinds of information.
Oh, no
So
way.
they will end up finding out, yeah, a lot about you, and then they will price their insurance based on that, unfortunately.
No.
Are you over 65?
55, but I had cancer and I had a massive stroke. So,
Okay, so here's why I'm asking that. When you turn 65, you get another guaranteed what do we call it? Guaranteed enrollment, or so
Yes.
you get another
You only
time,
get- Yeah, you only get the one chance.
right? You
I
get,
don't understand. I'm sorry.
yeah. So when you turn 65, you get another chance to enroll in a supplemental plan without having them ask you all those questions.
Oh, yeah, but in
But
10 years.
yeah, right.
you
I wish I could
know.
tell you, you could do it without all that, but you can't. But
Yeah.
you do, and you want to be sure that when you get to be 65, that you take advantage of that opportunity.
Okay, okay. I
Yeah,
appreciate it.
Yeah.
Thank you.
yeah, I'm glad there's at least a glimmer, but I'm afraid that's the best that's offered.
Okay, thank you.
Mhm.
Amen, but she's already on Medicare.
Okay.
Okay,
If there are no more questions, everybody have a great evening. Stay dry and don't get blown away. The sky is a really weird color outside my window right now.
it's changing every minute.
Yeah, it is.
Yeah.
Okay.
Thanks,
Okay.
Louisa. Take care, everybody. Be well.
Thank you for your time.
Bye-bye.